distinguished guests and speakers on the dais, Dr. Saujanya Madam, Dr. Balaji Garu, Dr. Kishore Garu, Dr. Fareen Madam, another Dr. Fareen Madam. Both are named by Dr. Fareen only, don't get confused. My dear faculty members, Dr. Suresh, Pharmacy Practice in charge, Dr. Sahu, B.Pharm Academics in charge, my dear colleagues, staff members, and dear students. First of all, there is a little delay in commencing the program by half an hour to 45 minutes. We were supposed to start by 2, but half an hour delay has happened. In fact, the doing of this event in association with the Prime9 channel and Prime9 health team, it had happened almost 3 to 4 months back when me and my colleague of Gayatri Pharma Solutions, Dr. Sundaraj Manvi, we approached Dr. Kishore Garu, who is the CEO of GVSK Pharmaceuticals, on some consultation work of Gayatri Pharma Solutions. You all know that we have come out with Gayatri Pharma Solutions R&D in our campus, where we are doing some R&D developments on some pharmaceuticals and nutraceuticals. And also we are about to start the analytical wing of that Gayatri Pharma Solutions very soon. So in that context, we would approach Dr. Kishore Garu, and of course, we would detail them about our Gayatri Pharma Solutions, our activity, and other things. And I just introduce myself. I am from the academics. I am heading Pulla Reddy Institute of Pharmacy. We have these courses running and all. The moment I introduced myself, he immediately asked, "Sir, why don't we conduct an awareness program on some health aspects in association with Prime9 channel and other things?" I said, "Fine, it's fantastic. If we can conduct such programs in the campus, all my students who are little familiar with pharmacology, physiology, and toxicology, and some of the PharmD students, they are doing the pharmacy practice in Star Hospital and other hospitals as well. Yes, definitely the health aspects like PCOD, management, symptoms, treatments, PCOS, safety protocols, and even the training on CPR. Of course, previously, we would conduct the training sessions on CPRs in association with some other hospital managements, but still, there are some fresh students who are sitting over here. They are supposed to know, because these are all emergency situations which are going to be explained to you in detail by our expert speakers that we have today with us, Dr. Saujanya Garu, and even we have Dr. Balaji Garu and Dr. Kishore Garu. They are going to explain you in detail about all these health aspects. As I said already, in fact, I welcome all these dignitaries on the dais to our Green Pulla Reddy Institute of Pharmacy campus. And you all should be happy for having them with us in this afternoon. And whatever they would deliver to you, I want you to gain the knowledge in those health aspects and try to implement in your daily life. That is what the prime idea behind conducting this event in our campus. Not only implementing this in your daily life, that means advices given by the expert speakers, But as a pharmacy students, as a science students, I also want you to guide your society, your community by and large. So that is what we are expecting from you. As I always advise you, whenever we do such events or some programs like this in our campus, I always guide you, advise you, not only to learn these safety protocols, but not only to implement in your daily life, in your house, in your community, but I want you to guide the society by and large. That's what just now I was talking to me and Dr. Sundaraj Mohan, we were talking to Dr. Saujanya. We were talking about a lot of other things as well. I was explaining them about pharmacology, how tough it is. She is telling that it's a very dry subject and all. Yes, it is dry subject, but still we have chosen this particular science of pharmacy as your livelihood. You have to be successful in this. To be successful in this, yes, you have to gain the knowledge. You have to have the complete knowledge about the safety protocols, because I see some of the pharmacy students, pharmacy practice students going to the hospital, and they'll be given the job of doing the counseling of the patients as well. So unless you know the symptoms and management and the drug-drug interactions and the polypharmacy, I don't think you are able to guide the patient, you are able to counsel the patient. In fact, we have Dr. Balaji also with us, who is having 20 years of experience in this particular field of psychology. And in the introduction speech, Ms. Sucharita has told that he is even guiding the IT employees and other sectors of industries also in the psychology aspects. So in fact, we are happy to have Dr. Balaji also with us today. And I think I welcome all this to our Green Campus, and I advise all the students to listen to them, and then there will be a small event after this. That means they'll be doing some personal guidance also. I want you to listen to them and participate in that guidance and make this event a successful one. Thank you, the organizers, for giving me this opportunity. Once again, I wholeheartedly welcome all these dignitaries on the dais for having come to our Green Campus and honoring the students and guiding the students. Thank you so much. Thank you so much.
It's really nice to see, I was counting close to 100 people interested in listening something that's pretty boring. Yeah. But then, jokes apart, as sir mentioned earlier, for me, pharmacy was the toughest subject because it was very dry, and seeing so many people so interestingly studying the same subject, I really should applaud you for the way you are putting your efforts. I know without that we don't exist. Without you people's efforts, we don't even exist. Our practices don't exist. Thanks for your contribution to the society. So, moving on. We are primarily a metabolic disorder remission center. We are one of its kind. We put a lot of effort into understanding metabolic disorder, and I would love to say that 95%, close to 95% and more of PCOS and PCOD are triggered as a metabolic disorder. If we really understand our metabolism properly, it's pretty easy to understand it in very early stage and address it in a comprehensive manner, and we don't need to struggle with it. All the infertility facilities that are cropping up, mushrooming today, are because of this metabolism driven infertilities. And if you think this is existent only in females, sorry to say, we have a lot of males, men coming with a lot of infertility issues, at least with females, because of menarche and monthly cycles, that the menstrual cycles and the disturbances in them. This disturbance, we can notice it early. We start approaching the doctors, we start working on it, and we can improve. But unfortunately in men, these do not crop up until they really look at begetting children. And that's much more a menace than the intensity of PCOS that is evident to us today. Because it is pretty evident, we are able to talk about it. Just imagine something that has a lot of stigma, something that they can't share with anybody, even that is metabolism driven. The whole hormonal imbalance that we are seeing most of the times is metabolic disorder driven. So that's where we started our life, and for us everything starts with the root cause of energy toxicity. We'll do a simple test for you. You don't need to no prick, no poke. You just have to hold a sensor and you'll get to know if just the BMI is the right parameter for you. We're all taught BMI, right? That's history. It is body composition that you should focus on. You should have adequate skeletal muscle for your basal metabolic rate to be right, so that you'll not land up in having excess body energy. Anything in excess is toxic, right? That toxicity is leading to cell toxicity, is leading to the hormonal imbalance. In early ages, what we see is PCOS, obesity, that's excess energy, and as age proceeds, we start seeing diabetes, hypertension, and the rest of the things. So everything is interconnected. If you think it's just unless you have acne problem, you don't bother about your PCOS. Trust me, it's much more than that. Your body shows so many signs to make you aware in both men and women. Hormonal imbalance. Now when I'm talking, I really was very happy seeing at least 25% of this, a lot being boys and men. I was really happy to see the crowd that way, because I thought I would see only girls, because it talks about PCOS and PCOD only. I really appreciate. So in both men and women, whatever acne that you start seeing pretty early in life is triggered with hormonal imbalance. Period. And the hormonal imbalance is because of your energy toxicity. So we'll start understanding what it is, and maybe we are addressing PCOS because that's the reason we are here today. But for the men, definitely Dr. Farheen will walk you through the little things that you need to understand. But let me tell you, let me reascertain, 95% of these issues are purely metabolism driven. Address your diet, address your lifestyle, address everything that you're eating, breathing, drinking, walking properly, and break this cycle. What's happening is we are transferring it to generations. Let's not do it. If once we break this cycle and move towards healthy lifestyle is not necessarily the tough one where you have to go get up at 4, do yoga, and then 2 hours. No. Be mindful with what you're eating. Be mindful with your lifestyle and have a balanced diet. Everyone wants quick fixes. Trust me, life is no quick fix. I wish anyone here would tell me life is a quick fix. Life per se is no quick fix. If you are investing these many years into your education, is it a quick fix? Getting a right job, landing in a right job, getting into a better life? Nothing is a quick fix. So you need to invest properly into your health. We had nobody to tell us. We were not really aware of it. But today your generation is the generation of information. You have so much of information. Don't get lost in that information. Apply your critical thinking. You're science students. You know science. Science is, it doesn't talk about faith. It doesn't talk about an influencer. Science is proof. Science is data. Science is what you get to see. So run behind data. Know it for sure. Apply your critical thinking skills. Don't get lost in this misinformation and quick fixes that the world promises. Do not run behind quick fix, because most of the children or adults, let me say, everyone wants quick fix today. Life is not so. So is lifestyle. Be mindful. So if you want to enjoy the junk taste till the fag end of your life, be mindful about consuming it. I'll never say don't consume it. Honestly, for everybody, even I get clients, I can't do away with alcohol. I never said do away with alcohol. Be mindful about it. Be mindful about your chocolates, pizzas, dosas, idlis, garas, everything that we are eating. Most of it is carbohydrate centric. And your science students, it should be very easy for us to communicate to you. You know the macronutrients. Get the right balance of macronutrients, and that's where the change starts. And the rest of medication is so that it doesn't get worse. We have to use it for a short while until we get our lifestyle into the right balance. That's all I have to say today. I would not really like to take too much of your time. And the other thing, we would be giving out some coupons to you people to encourage you to approach doctors. I know we have very low pocket money to really take care of ourselves. And end of the day, I would say depend more on nutraceuticals than medicines. Our food is not as qualitative. We cannot consume so much of macronutrients because we cannot expend so much of macronutrients. That energy we cannot spend. And when we can't spend, we are not supposed to consume so much of energy, which is impossible. This energy is what we spend. This energy we tend taking. And in that, you'll still have very less micronutrients. Please depend on nutraceuticals. This is my take. Having had the experience with so much of data, if you're not taking nutraceuticals, your hormonal balance is also getting disturbed. That doesn't mean you're spending thousands and thousands on it. Nutraceuticals are available at pretty low cost, and I hate tablets for nutraceuticals because that's not disease. That's something you're putting into becoming healthy. So instead of your protein shakes, boys, buy nutraceuticals. Protein shakes is not great. Trust me, it is excess protein load. Okay? With all that, I would give this the power of communication to our fellow doctors who would dive you more into the PCOS part of it medically and the impact, and also the impact of PCOS on your skin and hair. I know it is very important. I feel it now once I started becoming old. You start taking care of it very early. Don't take it for granted, honestly, okay? The impact of it, when I say PCOS, hormonal imbalance per se, okay? Impact of it on your skin and hair, the doctors will walk you through. Thank you.
Guys, by the way, I'm Dr. Balaji Vidadala, and I'm a psychologist. And I have worked for a very big IT organization as Vice President HR. I was into psychology department. Also, I have worked with all the Geetham universities as Director HR. I was into HR department, psychology department, okay? And here today, I'm so happy to be here as part of the team, and so happy to see you guys. But you know what? The Josh is missing. So can you please motivate me? Can you please encourage me? How is the Josh? Come on, how is the Josh? You should say, hi sir, I'm leaking the paper. Hi sir, okay? How is the Josh, guys? How is the Josh? Thank you here. Our organization name is Relive Healthy, and we take care of remission and reversal of metabolic disorders, and also we are complete point of contact of cosmetology, skin and hair. Also we are into dentistry and pain management, okay? So after this, we are going to do a small exercise, and I would like to request everybody to explore that. What are we going to do? We are going to do something called BCA, Body Composition Analysis. What is it? It is going to tell you where exactly you are standing in terms of your health is concerned. Nobody is going to give you injections, don't worry please, okay? You are going to stand on a machine, and that machine is going to throw a report with 18 to 21 parameters like your hydration, fat, muscle, visceral fat, subcutaneous fat, all these parameters actually. It's going to tell you where exactly you're standing. So our team is going to help you getting that BCA done. Please don't miss it. Everybody register there and get it done, please, in order to know where exactly you're standing in terms of your health is concerned. Well, again, we're running short of time. Okay, we'll see you again some other time with loads of time. We'll discuss in detail. We'll discuss about psychology also. It's all about science of behavior. Okay, and what is science? If you ask somebody what is science, I'll tell you common sense at its best.
No Josh, huh? Once again. So we'll do one small exercise, right? How you feel. Close your eyes. Close your eyes. Silence, please. Concentrate on your forehead. Inhale deeply. You can count 8 and hold for. Hold. Exhale. Energy, where it is energy actually? Where energy located in? Cell, exactly. Okay, cell is. So the major source of cell is oxygen. First is one, oxygen. Next, what is important for cell? Water, right? Another one is nutrients. These three very, very important for cell to live, right? But unfortunately, cell didn't like your biryani, your pizza, your burger, and so many things, right? But cell is required only three. One is oxygen, whether we are giving seed cell requirement of basic requirement of cell or water. Second one is water is essential. Almost more than 70% of water is required in the cell. And third is nutrients. Whether we are giving properly or not, we need to understand that is a life, that is a science. After that only is like a pharmaceuticals or nutraceuticals or B Pharmacy, M Pharmacy, engineering, so whatever it may be. This is a basic science is required to lead a life or to live. Is it right? But without knowing this, we study so many things. Okay, how many people are giving oxygen completely to your cell? Raise your hands. How many people are drinking per day minimum 3 to 4 liters of water? Very less, very less. Okay, 3 to 4 liters. Okay, at least 4 to 5 people are raising hands. See, oxygen. You know what is the lung capacity? Tell me, ma'am. Lung capacity? 4 liters. Okay. Unfortunately, we are using 250 ml, like breathing, like that. We are not inhale deeply. Okay, that's what all yogic people are. Inhale very deeply and exhale. So, one example, like a dog per minute, how many times inhalation, exhalation, you know? 16 times. 16 times. Tortoise, 3 to 4 minutes. Sorry, 3 to 4 inhalation and exhalation per minute. That's what tortoise live for 400 years. Dog only 12 to 16 years only. Okay, we need to control our breaths. How? For deep inhalation, at least morning, 10 to 15 minutes, we need to do some pranayama. Then only our body will charge completely with oxygen requirement will fulfill. First point. Second point is water requirement, 3 to 4 liters is very, very essential. Then third is nutrients, micronutrients and macronutrients, protein, carbohydrates, so many things, right? But we are not having the basic knowledge on our health. Please, this is what my fight. Okay, it's not only for the PCOS and PCOD. So we need to understand our metabolism. We need to understand first. So ourselves, then only we need to talk ourselves, right? Then only we can do a lot of things. So how many people are willing to, after completion of this course, like entrepreneurs, raise your hands? No? No problem. We're all willing to start on their own business. Please raise your hands. So all are ready to join somewhere else, right? So it is a very comfortable, sir. Why should we take a lot of burden, all these things? Right? You're thinking like that. Okay. Nice. First, so my thing is, please understand yourself. Then only your career or study and whatever it may be. First, be healthy and be happy. then only we can lead our lives. In PCOD, why we started this PCOD and PCOS awareness program means this month is so like World PCOD PCOS month, and this entire program we want to do something. We need to share our knowledge, expertise, panel knowledge to the people. So why means you're all our mothers, like, right, for second generation of the people. Already we landed to one or none, right? One or none. So if you imagine there is no none means after 100 years, no human being in the universe. That's what my problem. Okay. So please try to understand PCOD, PCOS problems. So what is the difference between whether you have that same problem or not? So if you have problem anything, please immediately consult doctors. Why? Because after marriage, suppose if you are not considering this is a problem, after marriage, so many problems. So because of maybe infertility or the expertise panel will tell. So first of all, thank you so much. So this giving the opportunity to start our PCOD, PCOS drives from such a great personality of Sri Pulla Reddy Garu University. Thank you so much, Sundar sir. And thank you so much, Dr. Saujanya Garu and Balaji Garu, our doctors, to accept this event to grand success. Thank you so much. Thank you.
We are very pleased to invite the great dignitaries today for this event. And my request is to understand about this, the issues, which is the common issues which occurs in the society, and getting awareness on this is very important for leading a normal life. We know that nowadays in this busiest life, we are not focusing on our health because of the busy life and also stress on the studies, stress on the professional, stress on family friend. We are, you are forgetting, you are neglecting the most important day-to-day activities which has to be taken care on our health. So it happens to everyone because now the lifestyle is different. The olden lifestyle was different. Nowadays the lifestyle is different. Everything is fast and stressful life. So we are forgetting and we are neglecting our health. It should not happen because neglecting our health will cause us many issues as we get older and older. That is the reason nowadays the lifespan is getting down, because we are neglecting our health. We are not focusing our normal health. So getting awareness is most important. And what is today's session is one of the most important for the female health. Female is the most important in the society. They are the, is a pole, is the main pillar in the family. Female either mother or a sister or anybody, they are the pillar. They're the main pillar in the society, the main pillar in the family. And female health is most important. Either mother, my sister, maybe wife, or maybe any the position in our human life. Female is the most important part of our family, our life. So taking care of their health is most important. It's a really good initiation about this session, and I request everybody take the help and get benefit and get knowledge of this. And thank you very much. Thank you very much.
PCOS or PCOD? So what is PCOD stands for? Polycystic ovarian disease, whereas PCOS stands for polycystic ovarian syndrome. PCOD or PCOS are often used interchangeably, but they refer to two slightly different conditions. Both involves the ovaries and results in hormonal imbalances, but they are different. There are difference in between two. The nature of the condition in PCOD. PCOD refers to a condition where the ovaries develop multiple cysts due to the overproduction of immature eggs, as you can see in the slide. These eggs become cysts which can enlarge the ovaries. PCOD is generally considered less severe than PCOS. Many women with PCOD can manage their symptoms with lifestyle changes. What are the causes of PCOD? Causes are lifestyle factors such as poor diet, lack of exercise, stress that can lead to hormonal imbalances. Symptoms are irregular periods, weight gain, mild hormonal imbalances. Women with PCOD may still ovulate regularly and fertility is less affected. What are the symptoms of PCOD? Irregular periods, severe acne, feeling fatigue, high testosterone level, abnormal facial hair, weight gain, ovarian cyst, mood swings, hair thinning. What are the treatment plans for PCOD? Lifestyle modification, diet, exercise, and stress management. Medications may be used to regulate periods or manage symptoms like acne and hair growth. What is PCOS? PCOS is a problem with hormones that happens during the reproductive years. If you have PCOS, you may not have periods very often, or you may have periods that last many days. You may also have too much of hormones called androgen in your body. Nature of the condition in PCOS. PCOS is more complex metabolic and endocrine disorder that not only affect ovaries but also other body systems. It involves multiple factors including insulin resistance, high androgen level, and chronic inflammation. More severe PCOS is considered more serious because it means it involves multiple symptoms like type 2 diabetes, cardiovascular disease, infertility, obesity, and endometrial cancer. It may be caused due to genetic factors, environmental factors, insulin resistance, and excess androgen level. Environmental factors include dietary consumption, sedentary lifestyle, lead to obesity, BMI more than 30. Symptoms of PCOS are ovulatory dysfunctioning includes amenorrhea, oligomenorrhea, irregular uterine bleeding, and infertility. If you have androgen excess, it may lead to hirsutism, seborrhea, acne, alopecia, virilization. Insulin resistance leads to acanthosis nigricans and obesity. Causes: insulin resistance, accumulation of toxins in the body, wrong dietary choices, genetic tendency, fetal exposure to male hormones, and hormonal imbalances. What is the treatment plan? Lifestyle modification, okay, exercise, you can manage your stress level, and if it is a severe form of PCOS, then drilling should be done. That is a surgical procedure. As there is a lot of men sitting here, I would like to talk about male infertility. So male infertility, it refers to man's inability to cause pregnancy in a fertile female partner. 1 in 20 men gets affected. What are the causes of male infertility? Sperm production issues due to low sperm counts or quantity or its shape. hormonal imbalance, which include issues with testosterone, LHS, FHS level, regulate varicocele, and large veins within the scrotum that can cause to raise in temperature and affect sperm production. Infection. Certain infections like STD, prostatitis can affect sperm quality or block sperm transport. Genetic factors, obstruction, that is a blockage of reproductive tracts. Lifestyle factors like smoking, alcohol, obesity, stress.
ఈరోజు మన పుల్లా రెడ్డి ఇన్స్టిట్యూట్ ఆఫ్ ఫార్మసీ క్యాంపస్లో Prime9 హెల్త్ టీమ్ వారి సౌజన్యంతో హెల్త్ అవేర్నెస్ ప్రోగ్రామ్ కండక్ట్ చేయడం జరిగింది. దీనిలో ముఖ్యంగా PCOD సమస్యలు, PCOS సమస్యలు, సేఫ్టీ ప్రోటోకాల్స్, ట్రీట్మెంట్, మేనేజ్మెంట్, వాటి గురించి పిల్లలకు అవగాహన సదస్సు ఏర్పాటు చేయడం జరిగింది. డాక్టర్ కిషోర్ గారు, డాక్టర్ సౌజన్య గారు, డాక్టర్ బాలాజీ గారు, ఇంకా ఇద్దరు డాక్టర్స్ ఈ క్యాంపస్లో ఇక్కడికి రావడం జరిగింది. పిల్లలకి అందరికీ బాడీ మాస్ ఇండెక్స్ అవన్నీ చెక్ చేయించి, రిజిస్టర్ చేయించి, ఏవైనా ప్రాబ్లమ్స్ అవి ఉంటే ఫ్రీ కన్సల్టేషన్ ఇక్కడ ఏర్పాటు చేయడం జరిగింది. చాలా మంచి ప్రోగ్రామ్స్, ఇలాంటి ప్రోగ్రామ్స్ కంటిన్యూగా ఈ క్యాంపస్లో జరుగుతూ ఉండాలి. Prime9 హెల్త్ టీమ్ అండ్ CEO గారు చాలా ఇనిషియేషన్ తీసుకొని ఇలాంటి ప్రోగ్రామ్స్, ఇలాంటి క్యాంపస్లలో, ఎందుకంటే యంగర్ జనరేషన్కి ఈ హెల్త్ ఆస్పెక్ట్స్ గురించి అవగాహన సదస్సులు ఏర్పాటు చేయడం చాలా ఇంపార్టెంట్. ఈ జనరేషన్లో ఇప్పుడు వాళ్ళు తెలుసుకొని ఏమైనా ప్రాబ్లమ్స్ ఉంటే ఇమ్మీడియట్గా దాన్ని రెక్టిఫై చేసుకొని ట్రీట్మెంట్, మేనేజ్మెంట్ గురించి ఆలోచించి వెంటనే దానికి తగ్గట్లు లైఫ్ స్టైల్ మార్చుకొని ఇదైతే డెఫినెట్గా వాళ్ళకు హెల్త్ బెనిఫిట్స్ చాలా ఉంటాయి. సో ఇలాంటి ప్రోగ్రామ్స్ మా క్యాంపస్లో అండ్ పక్క ఇన్స్టిట్యూట్స్లో కూడా అవేర్నెస్ ప్రోగ్రామ్స్ కండక్ట్ చేయాలని నేను అందరికీ విజ్ఞప్తి చేస్తున్నాను. అండ్ వెరీ ఇంపార్టెంట్ టాపిక్, అండ్ థ్యాంక్ యూ వెరీ మచ్ Prime9 హెల్త్ టీమ్ అండ్ డాక్టర్ సౌజన్య గారు, డాక్టర్ కిషోర్ గారు, డాక్టర్ బాలాజీ గారు అండ్ అదర్ టీమ్స్. అండ్ థ్యాంక్ యూ టు మై colleagues also for conduct this program in this green campus of Pulla Reddy Institute of Pharmacy. Thank you once again.
Good evening everyone. This is Ashwita from Pulla Reddy Institution of Pharmacy, studying Pharmacy second year. So today we are organized the awareness about PCOD. Many people they don't know what are the symptoms or what are the effects which are happening in daily in every people. Some people are thinking that only female only get the PCOD, but they don't know even though the male is also causing with PCOD. So due to the awareness of this PCOD, there may be future me also very good and they use it the people using in medications properly to avoid PCOD. So the awareness which was done by in our college was very important to us, and that one thing is we should also get awareness to the people who are in the society who are don't know the what are the problems which are affected by the PCOD. And next thing is what are the effects of PCOD was some many people they don't know what are the effects and what are the causes and what are the symptoms and how to cure and how to treatment about PCOD. Mainly the females nowadays mainly who are in hostels like that, they are mainly facing many problems about PCOD. So thank you for Dr. Kishore sir who are getting awareness about PCOD and all these things. Thank you.
Hello everyone, I'm Sashri Jayanti from PharmD 5th year. I'm a student of Pulla Reddy Institute of Pharmacy and our college has organized an awareness program on PCOS and PCOD. This session was really informative and has provided various insights on PCOS and PCOD, which is one of the most common problems in worldwide. And today we've got to know what are the common problems and how we can manage it with the help of daily routine, with the help of simple changes in daily routine. And I thank each and every doctor who has come up, shown up and spoke about PCOS and PCOD. Thank you.
Hi, I am Shreya. I am from Pulla Reddy Institute of Pharmacy. As our college conducted today a program on awareness of PCODs and PCOS, it is very informative to us. Nowadays, many women are facing this problem, so we have to bring awareness in them. Today we have learned so many things. Dr. Saujanya and their team was guided us very well. So we have to bring awareness about PCODs and PCOS in humans, women's and also men's. Thank you.
Hello everyone, my name is Meghana. I am from Pulla Reddy Institute of Pharmacy. I am a 5th year PharmD student. In our college, our college has conducted an awareness program on PCOD and PCOS problems, which is now generally creating a massive impact on female healthcare and even also on the males, which is this provides us very good information regarding our health, and we need to provide awareness to everyone. And it is an innovative thought. Our college has provided this, and we are very delightful and thankful to this session. Thank you.
My name is Chandana. I'm from Pulla Reddy Institute of Pharmacy, PharmD 5th year. Actually, ఈరోజు మా కాలేజ్లో అవేర్నెస్ ప్రోగ్రామ్ రిలీవ్ తరపున అవేర్నెస్ ప్రోగ్రామ్ క్రియేట్ చేశారు పీసీఓడీస్ మీద. చాలా ఇన్ఫర్మేషన్ సెషన్ డాక్టర్ సౌజన్య మేడం ద్వారా మేము విన్నాము. చాలా విషయాలు నేర్చుకున్నాం. ఇలాంటి అవేర్నెస్ ప్రోగ్రామ్ మరెన్నో జరగాలని కోరుకుంటున్నాం. థ్యాంక్ యూ.
Today in our college, Pulla Reddy Institute of Pharmacy, we have conducted the awareness program on the PCOD, PCOS and the safety protocol. So really it's a very good program and our students are benefited a lot. Even not only the students, even the faculty members also. So they have given the detailed idea about the PCOS, PCOD and what are the do's and don'ts and how to avoid this PCOD, PCOS. And regarding its harmfulness also they have told. So really it's a very good, and they have enlightened the many areas which we don't know about these diseases. And really, and also they are conducting some health checkup program also. So that is also definitely it is useful to our students and for us also. So this is it will give the guide. So what is the lacuna in our body and how to overcome that lacuna. Definitely this program is a very good program, and this type of program is requires one or two another programs also. Really it is a very good program. Thank you.
Hi guys, I'm Dr. Jyoti Chabria. I'm a senior consultant nutritionist with 36 years of experience. I'm very happy to be part of this program which I was invited for, a lecture on PCOD with Dr. Saujanya and team. And I think it was really well done. In fact, it was very beneficial to the students because these kind of programs to create nutrition awareness and awareness about hormonal imbalances is really important. I have my own chain of nutraceuticals, and today the whole world is moving towards natural stuff because of side effects known for allopathy. So thank you for having me here.
Namaste, నేను డాక్టర్ సౌజన్య, CEO and founder of Relive Healthy, and we specialize in remission of metabolic disorders, అంటే reversal of metabolic disorders like diabetes, hypertension, obesity, infertility, male and female both. So in this process, Prime9 వారు మమ్మల్ని ఇటువంటి ఒక మంచి సదుద్దేశంతో కూడిన ఒక మంచి కార్యక్రమానికి మమ్మల్ని ఇన్వైట్ చేసి మమ్మల్ని ఇందులో భాగస్వాములుగా చేశారు. PCOS, PCOD డ్రైవ్ అన్న ఒక మంచి ఇనిషియేటివ్ తీసుకొని ఈ లైఫ్ స్టైల్ ఇండ్యూస్డ్ మెటబాలిక్ డిజార్డర్స్ని అర్లీగానే వాళ్ళకి అవేర్నెస్ క్రియేట్ చేసి అడ్రస్ చేయడానికి మాకు ఒక మంచి ప్లాట్ఫామ్ ఇచ్చారు. అంతేకాదు అడిగిన వెంటనే పుల్లారెడ్డి కాలేజ్ వాళ్ళు, పుల్లారెడ్డి ఫార్మసీ కాలేజ్ వారు, ఆ యజమాన్యం మాకు ఎంత బ్యూటిఫుల్గా మినిమమ్ ఆఫ్ 100 స్టూడెంట్స్కి అవేర్నెస్ క్రియేట్ చేసే ఒక మంచి అవకాశం మాకు ఇచ్చారు. చాలా టైం కూడా ఇచ్చారు. వీఆర్ ఏబుల్ టు కమ్యూనికేట్ సో మచ్ టు దీస్ స్టూడెంట్స్ who are the future, who really are getting lost in a lot of misinformation today. Thank you, Prime9. Thank you, Pulla Reddy College of Pharmacy. Thank you all.
Hello, I am Dr. Siddhartha, Pulla Reddy Institute of Pharmacy. ఈరోజు మా పుల్లారెడ్డి కాలేజీలో పీసీఓడి మీద అలాగే దాని అవగాహన సదస్సు నిర్వహించారు Prime9 సౌజన్యంతో. సో ఇలాంటి కార్యక్రమాలు ఎన్నో చేయాలని మనస్ఫూర్తిగా కోరుకుంటూ ఈ డాక్టర్ సౌజన్య గారికి అలాగే వాళ్ళ సహాయ బృందానికి ధన్యవాదాలు తెలియజేసుకుంటున్నా. థ్యాంక్ యూ సో మచ్.